everyone, my name is Caitlin Wood. I am employed by the Lawrence County Health Department and I am a member of ADCES, which is the Association of Diabetes Care and Education Specialists. Diabetes management involves numerous categories including diet, exercise, skin care, medications, and healthy blood sugar levels. My personal goal for this presentation is to educate Lawrence County residents ages 45 to 65 on how to manage their new diabetes diagnosis. By the end of the presentation, at least 90% of participants will be able to demonstrate the proper use of a glucose monitor. At least 85% of participants by the end of this presentation will be able to list 3 essential diabetic skincare practices. To begin, we will introduce ourselves with our first name only. We're going to start with the front row, and everyone will go left to right. After introducing ourselves, we'll complete an icebreaker. Great, nice to meet everyone. To warm up, we're going to complete an icebreaker task. In front of each of you, there is a red card and a green card. I will ask 2 questions. One is true and one is a myth. For the statement you believe is true, hold up the green card, and for the myth, hold up the red card. Let's begin. The first question is, eating too much sugar causes diabetes. That's right, that's a myth. Question number 2, exercise helps lower blood sugar levels. Great, that is true. We will now begin the presentation. So like I said, this is going to be diabetes management for newly diagnosed diabetic patients. And that's all of my info. So my goal for this presentation is to educate newly diagnosed diabetic patients in Lawrence County, ages 45 to 65, on how to manage their new diabetes diagnosis. My first objective is by the end of the presentation, at least 90% of participants will be able to demonstrate the proper use of a glucose monitor. Objective number 2 is by the end of the presentation, at least 85% of participants will be able to list 3 essential diabetic skincare practices. So, what is the definition of diabetes? According to NIH, diabetes is a disease that occurs when your blood glucose, also called your blood sugar, is too high. Glucose is the body's main source of energy, and your body naturally makes glucose. We also can get glucose from the foods we eat. Insulin is the hormone that is made by the pancreas. That allows glucose to be used for energy. If you have been diagnosed with diabetes, your body either does not make enough insulin or it doesn't consume it correctly. The most common types of diabetes are type 1, type 2, and gestational diabetes. Here is just a picture of blood glucose levels, so you can kind of see they're low here, which is called hypoglycemia. Here they're normal, so you can kind of see they're all scattered throughout. And then hyperglycemia is too much, so you can see there's large amounts, too many. So, what is type 1 diabetes? Type 1 diabetes is an autoimmune disease that will require insulin for life. Your body makes little or no insulin at all. Type 1 diabetes is usually diagnosed as a young child and is often referred to as juvenile diabetes. It can appear at any time despite the nickname, and there is no cure for type 1 diabetes. Signs and symptoms and the treatment for type 1. Symptoms of type 1 usually include increased thirst, increased urination. There's sometimes bedwetting in children, increased hunger, weight loss without trying, mood changes, increased fatigue, weakness, and blurry vision. Type 1 diabetes is treated using insulin. It is important to manage the amount of sugar in the blood, so lifestyle changes and diet are important. Patients with type 1 require insulin throughout the day, so they may have an insulin pump with tubing or wireless pump. So here's just a diagram that shows different types of insulin pumps. Here's one with tubing, so you can kind of see, this is more the one that I used to see when I was younger. Everybody kind of had a little monitor on their belt loop, and then you can also see the tubeless, which is kind of the newer thing that everybody's using. Most people put it on their arm and it's connected to their phone. It also can relay messages to you, to your phone, that your sugar is too low It also may notify a family member if you're getting too low. So this shows how the tubing works. Insulin is injected into the fatty skin below fatty tissue below the skin, and it just shows the pump, your tubing, insertion site, and that is your infusion set. So what is type 2 diabetes? Type 2 diabetes is where your body does not properly use insulin. When your body does not properly use it, it is known as insulin resistance. The pancreas may be producing insulin, but not enough to keep blood glucose in normal levels. Type 1 diabetes is the most common form of diabetes. Genetics and being overweight can increase your likelihood of developing type 2 diabetes, and a person can develop type 2 diabetes at any age. So, symptoms and treatment for type 2 diabetes. Similar to type 1, you still have that increased thirst, that increased urination, hunger, fatigue, blurry vision. Sometimes you may also, one of the first signs may be a wound that is taking longer to heal, and tingling and numbness in the feet and hands. Healthy eating and exercise is really important in type 2 diabetes. Type 2 diabetic patients may also be prescribed an oral or injectable medication to help regulate their blood glucose levels. Metformin and glimepiride are examples of oral medications that may be prescribed. Ozempic and Wegovy are two injectables that may be prescribed. So there's a lot of people on GLPs right now, so you're probably very familiar with those. So here's just a little diagram that shows type 1 and type 2 diabetes. So it shows type 1 cannot be prevented or cured. Your body does not create the insulin. Causes are unknown. Genetics may play a role. It does require insulin injections for life. So type 2 can be prevented through lifestyle modifications. Your body does not create enough insulin or develops insulin resistance. Causes include genetic, aging, obesity, inactivity, and more. It does require insulin as needed, injected, or orally. So similarities between the two, they can cause other health problems and complications. They do require a healthy lifestyle and medical supervision. Symptoms include the same thirst, frequent urination, and blurry vision. So what does insulin do? Insulin is the hormone that's produced by the pancreas. When too many islet cells are destroyed, little or no insulin is produced by the body. Insulin travels through our bloodstream and it allows sugar to enter cells. It lowers the amount of sugar in the bloodstream. When our blood sugar levels drop, the pancreas allows less insulin to enter our bloodstream. So now, what is the role of glucose? Glucose is our body's main source of energy. The body's liver produces glucose, and we also can get it from our food. Glucose is a sugar that is absorbed into the bloodstream and enters our cells with the help of insulin. In a patient with type 1 diabetes, there is no insulin to allow the glucose into the cells. So this little picture just shows how does insulin work. You can see your insulin receptor and your glucose channel is closed. Here's your insulin and your glucose. So insulin is the key that unlocks the glucose channel. Glucose channel opens and glucose can enter the cells. So, how do we use a glucose monitor? You can choose a finger to get your sample from, but it is best to alternate fingers as they can become more sensitive over time. You're going to wash and dry your hands, preferably with warm water to help increase the blood flow. You're going to turn your meter on and you're going to prepare your strip by your device's manual. Many Accu-Chek meters turn on automatically when the strip is inserted. Prepare your lancing device according to instructions. Then you're going to lance your fingertip or other approved site to get a drop of blood. Be careful not to smear it. You just want to get that drop, not a smear. Touch and hold the test strip, opening to the drop of blood until it has absorbed enough blood to begin the test. When your blood sugar test results, then take the proper steps based on your healthcare team's recommendations if your blood sugar is reading too high or too low. Record your blood glucose results by writing them in a journal or a logbook, holding them in the meter's memory, or downloading them to an app or a computer so you can review later on. Always discard your lancet in an appropriate way, preferably a sharps container. So that way you can ensure injury is not caused by using a sharps container. So that injury is not as a result from not using a sharp container. So how is diabetes diagnosed? There are several ways to diagnose, including just a urine sample and blood sample. A1C and FPG, which is a fasting plasma glucose, oral glucose tolerance test, and a random plasma glucose test are different tests used to diagnose diabetes. A1C measures your blood glucose for the previous 2 to 3 months. If your A1C is greater than or equal to 6.5%, you are diagnosed with diabetes. A fasting glucose greater than 126 milligrams is diagnosed as diabetes. The oral glucose tolerance test is a 2-hour test that checks your glucose before and after drinking a sweet drink. If the glucose level is over 200 milligrams, diabetes is diagnosed. The random plasma glucose test is a random sample when a patient has severe diabetes symptoms. It is a blood test that's used at any time of the day, and diabetes is diagnosed if your blood sugar level is over 200 milligrams. So, managing diabetes. According to the American Diabetes Association, 1.4 million people will be diagnosed with diabetes this year. While being diagnosed with diabetes may seem overwhelming and stressful, it can be managed. After being diagnosed, it is important to create a plan of action for managing your diabetes. Diet, exercise, and medications can help manage diabetes. So, diet. You're going to work with your doctor to create a healthy eating plan. It is very important in managing your diabetes. It is important to fuel your diet with foods that are naturally high in nutrients but lower in fat and calories. It's also fruits, vegetables, and whole grains are essential for your healthy eating plan. When extra calories and carbs are consumed, it can cause a rise in blood sugar levels. It can lead to hyperglycemia or high blood sugar, and can have serious health consequences. Long-term hyperglycemia can lead to heart, kidney, and nerve damage. So, diet continued. A registered dietitian, in addition to your primary care physician, is beneficial for diabetic patients. A dietitian can plan out healthy eating options for newly diagnosed diabetic patients to manage their conditions easier. For diabetic patients, it is recommended to consume healthy meals at regular times. Foods that are high in fiber, healthy carbs, fish, and good fats are important. Fruits, vegetables, whole grains, legumes, low-fat dairy products are healthy carbs. Fruits, vegetables, whole grains, and legumes and nuts are fiber-rich foods that can help control your blood sugar levels. Salmon, tuna, and sardines are rich in omega-3s, and these are great to consume at least twice a week. Nuts and avocados are good fats that may help to lower cholesterol. Okay, so according to the American Diabetes Association, the diabetes plate is the easiest way to create healthy meals that can help you manage your blood glucose or your blood sugar. So the diabetes plate says, fill half of your plate with non-starchy vegetables like broccoli, spinach, or carrots. You're going to fill a quarter of your plate with a lean protein like chicken or turkey but no skin. Fill 1/4 with quality carb foods, fruits, whole grains, low-fat dairy, or starchy vegetables. Exercise. In patients with diabetes, exercise can be healthy to benefit the body. Before exercising, patients may need to check your blood sugar to make sure that you're not hypoglycemic. Adults should be exercising at least 150 minutes per week. Patients may have to work up to this amount, but aerobic exercises for at least 150 minutes per week is recommended for diabetic patients. Fast walking, lap swimming, bicycling, climbing stairs, dancing, and exercise classes are all forms of aerobic exercises that we want to be doing at least 150 minutes per week. 2 to 3 strength exercises per week is also recommended. Medications. So, Medications for managing diabetes can vary from person to person, can also kind of vary if you're type 1 or type 2. Some medications are taken orally and some are injected. Metformin is the most common orally prescribed medication for type 2 diabetic patients. It lowers the amount of glucose made and absorbed in the body. Metformin is a biguanides class drug. Other classes of oral diabetic medications include alpha glucosinase inhibitors, DPP4 inhibitors, meglitides, and sulfonylureas. All classifications of oral diabetes medications work in different ways to manage your blood sugar levels. Medications continue. So other options are injectables. Like I said earlier, there's a lot of people you probably know right now that are on Wegovy, Ozempic, or other GLP-1s. GLP-1 and dual GLP-1/GIP receptor agonists use the natural hormones GLP-1 and GIP to improve blood glucose levels. Trulicity, Ozempic, and Wegovy are common injectables used for managing diabetes. Some injectables have also been shown to help prevent heart disease. So, diabetes and skin complications. Our skin is our largest organ, and it can experience complications from diabetes too, according to the American Diabetes Association. So like I mentioned earlier, with one of the symptoms of type 2 diabetes, sometimes a delayed wound that is being healed may be a sign that someone is experiencing diabetes and does not know it. Patients with diabetes are more prone to bacterial and fungal infections. Infections and itching are also common. To prevent skin infections, it is important that patients keep their diabetes well managed. Diabetic patients should keep their skin clean and dry. You're going to want to avoid hot showers or baths. After your bath and shower, lotion is very important to moisturize the skin, but you do not want to put any lotion between your toes. That can create a fungal infection. Any cuts and sores should be treated promptly. Diabetics should do weekly skin assessments on themselves to monitor for blisters, infections, and other skin-related issues. So it's important that you're checking out wounds that may not be healed, always monitoring your feet, because you hear about patients having diabetic sores, diabetic blisters on their feet, and because of the neuropathy and the tingling, it's not always noticed as quickly. So we want to make sure that we're doing this weekly so that we can make sure anything that is going on, a blister, sore, cut, we're treating pretty quickly. So, some more skincare. Diabetes can infect the entire body, which includes your skin. Delayed healing of a wound or bruise is a symptom of diabetes. A patient with diabetes is at an increased risk of developing bacterial, fungal infections, and itching. High blood sugar can lead to dry, cracked skin, which may allow bacteria to enter and create an infection. All cuts and scrapes should be treated promptly to prevent an infection. Moisturizing is extremely important for diabetic patients. Like we said, avoiding hot baths, use a moisturizer but not between your toes, and talcum powder on areas like the armpits and groins can prevent skin problems. That talcum powder is going to help because it's not going to allow moisture to stay in these areas, and we know warm, moist environments can lead to infections. So, here is a picture of one of the diabetic monitors. So, this slide is going to be skincare for continuous glucose monitors and insulin pumps. Skincare is important in diabetic patients who wear a continuous glucose monitor. Let me go ahead and get all of these popped up. Not sure how this one got an effect on yet. Okay, so we know skincare is important for diabetic patients regardless, but it's really important for patients who wear a continuous glucose monitor. Skincare is an essential part of diabetes management. And with evolving technology, the number of patients using adhesive devices is only going to increase. Your skin may be managed by may be damaged by a reaction to the glue on the tape that can cause some itchiness and some swelling. The sensor could be stuck too tightly or too firmly on the body. Ripping of the skin when removing the tape. Scratchy, itchy skin can cause infections. An allergy may be present if the skin appears red and itchy. If the skin does appear red, tender, and there is pus, this may be a sign that there is some infection going on, not just an allergy. So, some common brands of moisturizing lotions for diabetic patients. We've got the Gold Bond Diabetics Dry Skin Relief. We've got the Aveeno Skin Relief for Diabetics Dry Skin. CeraVe has a Diabetics Dry Skin Relief Moisturizing Cream. And Ease Z has a Diabetes Dry Skin Therapy Lotion. And it has zinc added into it. And all of these are good for your dry, cracked, and problems with your skin. So there is my references. We're going to skip, and our next thing we're going to do is our activity. So for our activity, we're going to go through how to properly use an AccuCheck glucose monitor. So I've got those steps here. So regularly checking your blood sugar helps you control your diabetes rather than letting it control you. It allows you to see how your diet, exercise, and medications can affect your blood sugar levels. So, we are going to first go over the steps of how to use a glucose monitor. We're going to wash our hands. We're going to gather our lancing device. We're going to insert that test strip into the device. And we're going to prepare our finger with an alcohol pad. We're going to use the lancing device to prick the side of our fingertip and gently squeeze a small amount of blood onto the test strip. Avoid smearing. Allow a few seconds for the glucose monitor to read your results. Normal range for people with diabetes who check before eating, which is fasting, is 80 to 130 milligrams. If it's taken after you're eating, we want it to be less than 180 milligrams. You're going to dispose of that lancet in a sharps container and strip into the trash. You're going to place a cotton ball on the finger where the lancet was used. We will allow 5 minutes for participants to answer any questions. So, does anybody have any questions? Okay, great. Moving on. So the next thing we're going to do is, if everyone will get out their phones, we're going to take a really quick quiz on Kahoot. Now I'm just going to go over these questions here. So, when using a lancing device, you must prick the top of your finger. True or false? False. Normal range for people with diabetes who check their fasting glucose is 80 to 130 milligrams. That is true. Diabetes does not affect our skin. True or false? That is false. It does affect our skin. High blood sugar can lead to dry, cracked skin, which may allow bacteria to enter, leading to an infection. True or false? That is true. It is not important for diabetic patients to moisturize. True or false? False. A patient with diabetes is at a decreased risk of developing bacterial infections, fungal infections, and itching. True or false? That is false. Question 7. Patients with diabetes should regularly inspect for cuts, sores, redness, or signs of infection. True or false? True. Dr. Scholl's diabetic socks are a great option for patients with diabetes. True. Does anybody have any questions about any of those? Okay, great. So to close this presentation, I'm just going to ask a question. Who can tell me the most commonly prescribed oral medication? Yep, that's right. It's metformin. Is there anybody that has any questions? All right. Well, Thank you for attending this presentation. I hope you all learned how to manage your diabetes, skincare practices, and how to use a glucose meter at home.